Hello everyone, I'm Dr. Priti, developmental pediatrician practicing in Navi Mumbai. I run a multidisciplinary center in Tender Kids, where along with my team member we diagnose and provide various therapies required for children with neurodevelopmental conditions. Second April is observed as World Autism Awareness Day. So on this occasion, along with Indian Academy of Pediatrics Navi Mumbai branch, I will be talking on early detection of autism and importance of early intervention in them. Prevalence of autism is growing at alarming rate. World Health Organization data in year 2019 suggested 1 in every 160 kids been diagnosed with autism. Autism is a neurodevelopmental condition affecting primarily one's social communication abilities. It affects early child development and can have a significant social, language, and cognitive deficit, as well as can have a challenging behavior if not caught early. Human understanding about communication is more focused on one's ability to speak with others. That's the commonest reason why parents seek professional help if their child doesn't talk by 2 or 2.5 years of age. Many of them get diagnosed with autism by 3 to 5 years or later on, completely missing the window of opportunity for early intervention. Not many are aware about early social communication skills which develop before and are prerequisite for development of spoken language, and wanting to look on possible red flags or early sign of delay in these skills to identify kids at risk for autism. So let's see 10 important early signs to be observed in children before 2 years of age. Babies are motivated to be near you, look at you and linger in your eyes. If you find hard to get your child look at you, it can be an early sign of autism. Babies readily share their joy by smiling, laughing and looking at you. Children with autism generally have less facial expression, rather have a flat affect and rarely smile. Babies are eager to grab your attention, use objects to get your attention. If your child is more focused on object than person, then it's a concern and can be a sign of autism. Babies readily respond to their name by looking at you and understand other social beats like come here by stretching out your hands. Children with autism fail to respond to their name or understand other social beats. By 12 to 14 months, babies start drawing your attention to things of their interest by pointing and showing to it. Children with autism rarely use gestures like showing and pointing. Rather, they develop an unusual way of communicating like using your hand instead of them as a tool to indicate the things of their need or interest. By 13 months of age, child learn to look at people and start copying their action, what they see, what they do. And same thing they use in the play. They may sip on a cup or eat from a spoon or may offer a cup of sip to you or may hug a teddy bear or give a blanket to them to sleep. If you find your child is showing no to little imitation or not pretending in a play, it can be a concern. Children with autism may sometimes show unusual stiffening of lowering of fingers. They may sometimes show unusual repeated movements with an object like rolling, lining, rotating, or other kind of repetitive actions which are unusual at that age. Babies readily can shift their attention from person to object, from object to person, and learn through the social interaction. Children with autism can have overly focused and it becomes difficult for them or you to shift their attention from their things of interest to something else. Babies with autism can sometimes show unusual reaction to certain sound, sight or texture. They may get overly focused on page of book or can avoid certain taste or avoid certain texture of clothes or can close their ears on loud noise or squint or lap a hand on their in front of their eye when looking at light shows. Babies with autism may sometimes show a very strong interest in some unusual sensory experiences like sniffing or clicking on an object, rubbing on texture, certain textures, exploring by corner of their eyes or closely monitoring wheel of a car or blocks. Deficit in social communication skill can be red flag for autism. So children with social communication delay need to be evaluated for autism. Not every child with social communication delay will be diagnosed with autism. Most important learning occurs during the first 3 years of life. The brain and the nervous system of a newborn is not fully mature. Parts of the nervous system develop as an infant, and young children start learning by exploring with people and objects their environment. The wiring of the nerve cells are more rapid during this crucial 3 years. By age of 3, most of the major brain structures are developed, and later it becomes more difficult to make any significant change in child's brain or nervous system. A stimulating learning environment in these first few years is critically important to support positive outcomes. Early detection and early intervention can have lifetime impact on children with autism. This opportunity to catch early signs of autism can help you to guide your child to success. Hence, hence don't delay in seeking professional help if you find early signs of autism in your child. Lastly, I would like to end my talk by quoting famous Russian child psychologist Vygotsky: "What a child can do today with assistance, will be able to do by herself tomorrow." Thank you.